Hello friends, today we'll discuss about coding guidelines for ICD-10 codes for two or more diagnoses. There are combination codes in ICD-10 codes which are used for coding multiple diagnoses. So let us check what is the definition first for combination codes. Combination codes allow for the reporting of a single code to express multiple aspects of the diagnosis. The ICD-10 coding guidelines for coding and reporting describes a combination code as one used to classify the following: two diagnoses, a diagnosis with an associated secondary process, a diagnosis with an associated complication. So combination codes can be reported two diagnoses as one diagnosis, and combination code can be involving any manifestation code also, or combination code will also be associated with a complication. So let us check few examples. So here one is intervertebral disc disorder with radiculopathy. So here, for example, there are two codes: M51.26 for other invertebral disc displacement for lumbar region, and there is also one code for M54.16 for radiculopathy lumbar region. Here the combination code will be representing as M51.16 for intervertebral disc disorder with radiculopathy. So here this single code will involve both the intervertebral disc displacement as well as the radiculopathy for lumbar region. So this will be the combination code for both these diagnoses. Another one is hypertension and heart disease. So this is also very common, and many coders knows the coding guideline for coding hypertension and heart disease. Here we can assume a relation between hypertension and heart disease unless and until the provider has documented as they are unrelated. So when the provider has not documented as they are unrelated, you can code and assume them as one diagnosis. So here you can say you can code the combination code as I11.0 for hypertensive heart disease with heart failure, or I11.9 hypertensive heart disease without heart failure. So if there is heart failure, use the I11.0 followed by the additional code to identify the type of heart failure from I50 series, and when there is no heart failure, you can code only the hypertensive heart disease without heart failure. Same goes with hypertension and chronic kidney disease. The hypertension and chronic kidney disease condition should be coded as related even in the absence of provided documentation explicitly linking them, unless the documentation clearly states the condition are unrelated. So till the documentation does not state that the condition are unrelated, you can code a combination code for hypertension and chronic kidney disease. So here there are two codes for combination code: I12.0 and I12.9. I12.0 is used for hypertensive chronic kidney disease with stage 5 chronic kidney disease or end stage renal disease. So for end stage renal disease and stage 5 chronic kidney disease, you will use I12.0 along with the additional code for specifying the chronic kidney disease N18.5 or N18.6. And for other I12.9 hypertensive chronic kidney disease with stage 1 through stage 4 or unspecified chronic kidney disease, you will use I12.9 along with the additional code to identify the stage of chronic kidney disease from stage 1 to stage 4, and for unspecified chronic kidney disease N18.9. Some of the other examples for combination codes in ICD-10: I26.01 septic pulmonary embolism with acute or pulmonary, K57.21 for diverticulitis of large intestine with perforation and abscess with a bleeding, E11.341 type 2 diabetes with severe non-proliferative diabetic retinopathy with macular edema, E10.21 type 1 diabetes mellitus with diabetic neuropathy, I12.110 atherosclerotic heart disease of native coronary artery with unstable angina pectoris, K80.67 calculus of gallbladder and bile duct with acute and chronic cholecystitis with obstruction, K71.51 toxic liver disease with chronic active hepatitis with ascites. So if you see all the examples, you can see each code has more than 2 or 3 diagnoses. So all these combination codes can be used to represent 2 or more than 2 diagnoses. So you have to use combination code when as per the ICD 10 coding guidelines whenever it is required. So please, if you have any doubt or anything, you can code in the you can give your feedback in the comment section. And if you have gained any knowledge of coding combination code through this video, do share this video and like this video, and please subscribe to my channel to get all the updates related to medical coding in future. Thank you.